Speaking of unsolved mysteries, what would your explanation to a patient be who, like, let's say that example I had of the cellulitic leg and ankle, where there is no known insect bite, no open wound. This patient didn't have even a previous history of venous insufficiency, which, as we know, can develop into a cellulitic leg. How do these things seat? What's the best way to describe that or explain that to a patient?
They really are. I mean, it really is a mystery. Now, in your case, you mentioned it was a beta hemolytic strep, which gets me thinking that the probable source of it was oral. The patient probably developed a bacteremia, whether it be a transient
She did
bacteremia.
mention some respiratory type things.
Yeah. So it could have been a URI, an upper respiratory source. It could have been an oral source. We know that, when you floss your teeth, when you eat pretzels, when you eat anything, you cause transient bacteremias. And in the mouth, in the human mouth, you primarily have strep. So it's possible that the patient developed transient bacteremia, got strep, and because of something in that ankle, be it previous trauma, something making the blood flow a little more sluggish, it just seeded. We don't always have answers. We don't always have answers for why patients develop osteomyelitis, for instance. Especially if it's
Sometimes dental
not.
manipulation and even dental cleaning can cause bacteremia.
Absolutely, but there's no recommendations for prophylaxis, by the
But
way.
watch out, if the patient develops a fever, they might die in a few days. I've seen it happen.
Yeah.